Fat grafting to the face, or fat injections to the face, involves transplanting fat cells from one area of your body and grafting them or moving them to deficient areas of your face. So the goal with fat grafting to your face is to restore volume in the areas of your face where you have lost volume due to aging. So the fat is harvested from your thighs, your abdomen, somewhere where you have extra fat to donate. The amount of fat that I need to inject in your face is not very much, so you probably won't notice a change where I remove the fat from. If you want to notice a change where I remove the fat from, then you should have a liposuction treatment of that area. The cannulas I use to harvest the fat cells for injecting in your face are very small and they have very tiny holes, so it would take a lifetime to remove all the fat from a given area with one of these cannulas. But the reason I use these little cannulas is because I want the fat cells that I transfer to your face to be very small and pure, kind of like very, very tiny pieces of sand, and that way it's not lumpy or bumpy. So once I suck out the fat that we need to use, basically we harvest the fat cells from your donor site, which would be your belly, your thighs, somewhere where you have extra fat to donate. The fat cells are then processed and purified and transferred into special syringes, and then with a cannula, I will inject those fat cells into the deficient areas of your face. Now, there's really no incisions that I need to do this, it's just needle sticks to graft the fat to your face. I do need to make a tiny incision where I suck the fat out, but it's tiny, a few millimeters in length, and then it's just needle sticks on your face to inject the fat. Now, we need to inject more fat than you need because not all of it lives, meaning there is not a 100% take. A significant amount of it will dissolve and go away, about 30% in the face. So I do need to overcorrect the treated area a little bit to compensate for the amount of fat that's going to go away and the swelling and the swelling of the tissues as well as the fluid that's transferred with the fat. So keep in mind, I'm going to overcorrect the area with fat. You're also going to be swollen, which will add even more volume to that area. But as the swelling goes away, the fluid gets absorbed and some of the fat cells don't survive, the amount of volume will go down. And so I'm kind of thinking in the fourth dimension of time when I'm injecting fat, knowing that not all of it is going to stay. The other point I want to mention is that it is very difficult to overgraft an area of the face, meaning a given recipient bed can only accept so many fat cells, and any additional fat cells simply will not survive. So it's sort of self-limiting as to how much fat we can get to survive transfer in a given area, because eventually the tissues become saturated and they simply cannot accept any more fat cells. So that is fat grafting the face. It's a treatment that solves fat atrophy or deficient areas of volume on your face. It utilizes your own fat cells, so it is much more permanent and much more cost effective for multiple areas if you need multiple areas treated. The other thing to know about fat injections is that it is a little less predictable regarding how much volume will stay. So we have to overcorrect knowing that some of it will go away. Compared to fillers, it is certainly a much better solution to treat multiple areas of your face. Fillers are very expensive, they are temporary, whereas fat injections are much more cost effective in a large volume and are more permanent and create a more natural appearance and look once you have healed. The most common areas where I will inject fat grafts into the face include the temporal region, the upper eyelids, if the upper eyelids are hollowed out, the malar region, which is the upper cheek, the nasolabial folds, as well as the marionette lines, and finally the lips. So those are all the common areas that we inject fat into the face. And I should also mention, some people as they get older have deflated earlobes, and we can also inject some fat into the earlobes. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.